So the 6 pillars that I've settled on and have honed over the years are sleep, nutrition, movement, relationships, productivity, and happiness and mental health. And the first and most important of these is always sleep. And if sleep is a problem for you, that's the most important place to start, because none of us can perform well in any area of our lives unless we're sleeping well. Sleep is not a problem for everyone. And if it's not the place you want to spend your time and energy. You want to save that time and energy to focus on the area that is a problem for you. Or just, it may not even be a problem, but just an area in your life that you think there's room for improvement. Something that's been in the back of your mind that you're thinking, I really would like to eat a little better, or move a little more, or attend to a mindfulness practice. These are all things that are worthy of your attention. So the second area that I talk about is nutrition. And of course, in society today, we know that every magazine article, every newspaper you pick up, every site you go to on the internet is just filled with information about what one should and should not eat. And it's confusing, and in this area, even the science isn't particularly clear. But it does come down to some really basic recommendations. The third area is movement. And I have settled on the term movement because I found exercise was a bit intimidating for people, and it isn't. Formal exercise is absolutely not necessary in order to reap the benefits that are available to one when you move more. And in fact, the greatest benefits from moving more come in the early stages of moving. So people who are moving very, very little and begin to move a bit in their daily lives reap huge benefits. If you're already a very active athletic person and you're just trying to push it up another notch, yes, you may have more fun, you may have developed more prowess in your area, but in terms of overall health benefits, it's not nearly as great as the people who go from being sedentary to starting to move a bit. So those are really the concrete top 3 that everybody can participate in as an individual. But the last 3 categories are things that involve our interaction with society. They're a little bit more complex, and they often get underappreciated when people are talking about ways in which we can benefit from changes in our behavior. So the next category that I like to talk about are relationships. And the science in this area is very clear that having high quality, intimate relationships is extremely important to preventing mental illness. There's good evidence that it's a protective factor against our 2 greatest causes of illness in the modern society, that is cardiovascular disease and cancer. And it turns out that it's not the quantity of relationships that makes a difference, it's the quality. So having 1, 2, 3 intimate relationships where one is able to feel they are themselves and feel very connected to another person allows you to reap the benefits from having healthy relationships. On the wider social perspective, having healthy relationships allows us as a society to understand and have empathy for people who are different from ourselves, which is something that we sorely need in our society today. And the research is very supportive that if one is able to put themselves into the shoes of another person, it creates empathy, and we have an improved social structure because of that. The next area that is important to consider is productivity. And this is all this, sort of overlaps with the idea of purpose in life. And for a short form, I like to call this category work, even though it may be a formal work, but it may be volunteering, it may be participating in the creative arts, but the sort of things that allow a person to get into flow in the moment, produce something that they think is valuable in terms of an actual functional object or ideas that is satisfying to them, but also contributes to society. So the sixth category is actually, for me, the most important category after sleep, which I always reserve as the number one thing to consider. But this is the category of happiness and mental health. And it's that area of life where we all need to consider the concrete problems of depression and anxiety, things that get diagnosed in doctors' offices and as more significant problems, but a bit of anxiety and a bit of depression or feeling down on occasion is actually part of normal life. The key here is to have strategies that allow you to cope with those situations where you're feeling a bit anxious or a bit down. I have over the years talked to people who've had significant problems with depression or anxiety, and they sometimes get the idea that being mentally healthy means that there is an absence of those qualities, which is actually not the case. A short form way I try to think of it is we all have an hour in every day where we're feeling a little bit down. We have a day in every week where we're feeling a little bit down, perhaps a week in every month, and a month in every year where we're just not functioning at our optimum. But that's normal, and that's mental health. That is not the definition of poor mental health.